You've had an incredible career as an actress, but you've also become such a powerful activist around a variety of different human rights issues. Where did you find and where did you develop your voice to do that?
Well, I think I was inspired by my mother and my father, who very early on were very passionate followers of Dr. Martin Luther King. My mom marched in Washington with him. She did a lot of volunteer work, also a lot of things like working on Norman Vincent Peale's Helpline, which is a suicide prevention hotline in New York. She would come in, we lived in Tenafly, New Jersey, but she would drive in several times a week and spend hours on the phone literally talking people off of ledges. I mean, she literally prevented people from taking their own lives on the phone. And just seeing her commitment to helping others and being awakened to sort of social justice issues through Dr. King and through reading Anne Frank at 10 and studying the Holocaust. And I just became kind of enraged in a way at the injustices that occur in our world due to prejudice or hate.
You've recently become involved with EngenderHealth. What drew you to the organization and to the cause?
Well, there were a couple of things. One was reading Nicholas Kristof's and Cheryl Ludun's Half the Sky, because when I hit those chapters about death during childbirth for women in developing countries and complications and death arising from fistulas, I almost couldn't continue the book. I was so devastated by some of the stories there, and then I also had my own real scare. I was with my third child, Holden. During his pregnancy, I had a complication and I had to be hospitalized for 9 weeks of the latter half of the pregnancy, and was told that I might lose the baby and that I could also lose my own life if I was not careful. And it was all very crazy and very new for me and very sobering, and I came out of it fine, and my baby came out of it fine. We had no lasting effects, thank God, but that's due to the amazing healthcare that I had, the amazing doctors and nurses that worked with me during that time and kept me safe. If I had had that problem in another country, I might have died during the pregnancy, my son might have died, and I would have left my other two children motherless. And that really hit home, thinking about what EngenderHealth provides around the world. You know, there's every 90 seconds, a woman dies during childbirth around the world. Every 90 seconds. 99% of deaths during childbirth are in developing countries, and 90% of those deaths are preventable. So EngenderHealth is training medical staff, training community leaders, helping equip medical centers for maternal care. They're also spreading information about contraception to women who need it most. And contraception is so important because it allows a girl or a woman to choose when they want to have children. And, many young women are really too young to have babies. And if they do start having babies very young, chances are they'll drop out of school. Their chances for complications during the pregnancy or birth are much greater because their bodies aren't really equipped yet to handle a pregnancy and a birth. And if they stay in school and they have children when they want to later in life, they will get a job, that money will go back and be reinvested in the family, and then the family is investing in the community, and it helps overall growth and development of a culture. Certainly, it has a ripple effect on the entire community. So it's gigantically important, and I think far too few people think about maternal health, but it's huge. And I think it's just part of a gender bias across the world that, it's just not considered that important, that millions of women are dying preventable deaths. It is important, and we are important as a gender. It is important that women survive. So I think it's great what they're doing.
Since you became so passionate about these issues and started to develop your voice as an activist, what's been the biggest lesson for you in terms of how to most effectively channel that voice, channel that influence, and what advice would you give to others who are looking to be champions of causes and find their own voice?
I think they have to follow their heart to see what is that thing. In acting class, my wonderful acting teacher, Wynne Handman, used to say, find the pinch that creates the ouch. So in case of activism or getting involved or volunteerism or changing the world in some tiny scale or grand scale, you have to find the thing that makes you hum, you know, the thing that makes you happy and the thing that makes you angry, and combine those two. Like, what's your great skill set? What are you good at? What do you love doing? And what can't you stand that you see happening in the world? And what do you wish you could change? Well, guess what? You can change it. I mean, that's the thing when people say, what can you do? No, everybody can do something. Everyone can make a huge impact. But they need to combine that love and that righteous anger and put them together, and then they'll really achieve something. But don't be content just on awareness raising. That's something I would say. I think there's way too much like contentment, like stopping at awareness. But everything is possible. I'm very much like, I have this Captain Kirk thing where I don't accept the no-win scenario. And if you believe that you can do something and you really, really care about it, I believe you can do something. Where you'll get with it, who knows, but you will do something.